Hello, and welcome to Anatomy with John and Scully. Today we're talking about the iliacus muscle, going over origin, insertion, action, innervation, and blood supply. Thank you for joining. Okay, so iliacus. Starting with the origin, you'll see above. Looking at the left side of Scully's pelvis, it's going to originate in the superior 2/3 of the iliac fossa, the ala of the sacrum, the anterior sacroiliac ligaments, and the iliac crest. Moving right along to the insertion, it's going to insert onto the lesser trochanter of the femur and the shaft just below, as well as the psoas major tendon. Moving right along to innervation, it's going to receive innervation from the femoral nerve, which is coming off of the L2, L3, and L4 nerve roots. So if we count up the vertebrae, here's 5, 4, 3, 2. And so exiting below will be the L2 nerve root. And here's L3, exiting below the L3 nerve root. And here's L4, exiting below will be the L4 nerve root. And that's going to travel to become the femoral nerve and supply the iliacus through here. Moving on to blood supply, we have the aorta coming down, which bifurcates into the common iliac arteries, which is going to further bifurcate into internal and external iliac arteries. We're going to follow the internal iliac artery this time, and we're going to have a small branch called the iliolumbar artery coming off of the internal iliac artery right around here. And the iliac portion of the iliolumbar artery is going to supply blood supply to the iliacus. Lastly, looking at action of the iliacus is going to be, Scully's hip's just a little jammed, is going to be to flex the hip, so hip flexion. Okay. And it's also going to help to stabilize that hip joint. So hip flexion and stabilization of that hip joint. And so there you have it. Origin, insertion, action, innervation, and blood supply of the iliacus muscle. As always, thank you for joining, and do not forget to eat your leafy greens. Take care, folks.